Okay, let's look at a relatively new fetal assessment tool, and that is umbilical artery Doppler. The umbilical artery Doppler is based upon ultrasound. What we're looking for is the blood flow in the umbilical artery during diastole. What you'd expect is there is forward flow in the umbilical artery during the systole, of course. But what happens during diastole? Normally in utero, there is decreased resistance, which means there is increased diastolic flow. And as the pregnancy goes on, the diastolic flow should get more and more. If we've got a problem and there is vasoconstriction, the diastolic flow decreases. The only clinical situation in which umbilical artery Doppler is found to be helpful is with intrauterine growth restriction fetuses. And so it is used only there. What are the criteria for a non-reassuring umbilical artery Doppler? And what we're looking for is absent diastolic flow or reversed diastolic flow. Let me show you some pictures. Here we have a tracing, and this is the peak systolic. This is the diastolic flow. Our interest is in the diastolic flow, and you can see there is diastolic flow all the way through the cycle at this level. This is reassuring. Normal, forward diastolic flow. Now look at the next picture. What do we see here? This is the peak of systolic flow, but where's the diastolic flow? There is none. Absent diastolic flow. Not reassuring. This shows significant vasoconstriction. The worst is yet to come. What do we see here? This is the peak systolic flow, but what happens in diastole? The flow actually goes backward. We call this reversed diastolic flow. If we have IUGR baby with reversed diastolic flow, that is really troublesome. And this baby probably needs to be delivered. Normal, absent diastolic flow, reversed diastolic flow. And that's the end of umbilical artery Doppler.